Hello, my name is Yemi Babatunde. I'm a researcher in evidence synthesis at Kew University. You have probably read our blog about our patient and public involvement project, finding out what matters, using heart to elicit research ideas from people in traditionally underserved groups. If you haven't, please head over to spchr.nihr.ac.uk /projects finding out what matters for a brief about how our project was conducted. In the next few minutes, I'll be presenting the artwork produced as a result of our involvement with three underserved groups: people with young onset dementia, South Asian women, and older adults with musculoskeletal problems and mental health difficulties. We had meetings with individuals from each of these groups to discuss their experiences of health, services, and care. I'll be explaining the pieces of art produced to depict the group discussions and the research priorities that were developed from these meetings. First, from Oxford, and working with people with young onset dementia and their carers, we present Untangling Dementia: Understanding Personal, Social, and Structural Influences on Experiences of Dementia to develop priorities for research. Here in this artwork, we depict the face of a person with young onset dementia and the day-to-day issues that they encounter. You see the straight background threads here symbolize feelings and memories that haven't been affected with dementia. The faint and slanted lines represent memories or aspects of life that may be starting to fade. People living with young onset of dementia express the need for help with feeling themselves as much as possible, even as the disease progresses. The threads also reflect different services that are part of the person with dementia's life, which should be supporting them but can get tangled and crossed and messed up. For example, professionals not talking to each other, family members not hearing about available help. This fits with the key research priority identified during the group meeting. Basically, to understand how to bring about better coordination and connection in terms of support that is available for people with dementia so that it is equitable, joined up, and so that family members don't just hear about things through the grapevine but are able to access all the support that could be available to them. You can also see some missing features in this artwork. The gaps in the face highlight how people can lose their confidence following diagnosis with dementia, and this makes connections with others really hard and difficult for them. This again highlights the need for appropriate and coordinated support post diagnosis so that people with dementia can be helped to live as full a life as possible. Finally, you can see words on the canvas. The words on the canvas reflect part of the group's discussion, especially when they talked about lack of consistency in the support that they have received and they have assessed. Secondly, from Bristol, and based on our involvement with ethnic minorities, specifically South Asian women, we present to you meanings of menstruation and menopause, cultural influences on management and experiences. On this artwork, you can see this depicts the dignity and beauty of womanhood, along with the myths, the rumors, challenges surrounding menstruation and menopause. The research priorities included issues around consent for health research, and most importantly, they talked about improved knowledge sharing and information on menopause and menstruation. This artwork shows the veiling of a young woman, a daughter by an older woman, presumably the mother. Asian women involved in the group discussion reflected that it was considered uncomfortable to talk about menstruation and menopause. This highlights a lack of knowledge and the difficulty of discussing women's health issues in public, especially in the presence of male members of the community. For instance, while celebrating Ramadan, women can eat if they are having their period, but many feel that they need to eat in secret so as not to have to discuss such issues openly. So, the hidden nature, myths, and rumors surrounding menstruation are nested in the context of flower uteruses in the background of this artwork. This is to show the beauty of womanhood that women from these communities rightfully acknowledge, even if it isn't always a pleasant thing to talk about or be proud of, especially in the open community. Finally, to our last project, based on involving and engaging older adults with multiple physical and mental health conditions in setting research priorities, I present to you the trilogy of hands. In our discussions, we first of all looked at the day in the life of an older person with multiple conditions. And the challenges included in their day could include issues such as loneliness, isolation, being a burden to others, the burden of living with their multiple health conditions, the lack of information, for instance, lack of navigation, inadequate signposting, lack of feedback, for example, following their test results, the risk of misinformation from social networks and self diagnosis, and the burden of finding the right information from the internet or varied other sources. These people also talked about their need for direction on where to go for information, especially information about self management. They also talked about their guilt or fear of being judged as wasting health professionals' time at consultations. All the highlighted issues were categorized into three headline priorities represented in the trilogy hat. These are information needs, quality of life, and cost of care. According to Aristotle, the hand is a tool of tools. It represents strength, power, protection, and stability. We can here see that people with physical and mental health conditions suffer from triple whammy of lack of information, represented in palms on the face covering the figure's eyes. This gesture symbolizes confusion and or hopelessness as a result of lack of information or confusion ensuing from conflicting information from varied sources. It also relates to feelings of loneliness and isolation. The elderly aunt, clasped by a younger one, symbolizes concerns related to quality of life. This can be interpreted from various perspectives. It can symbolize appropriate help at the appropriate time and support in the local community. Alternatively, it could also symbolize the other person's need for friendship and fear of being alone or being a burden on relatives. Lastly, the hands counting coins symbolizes issues relating to cost of care. Older adults indicated the willingness to contribute to cost of their own care, and they emphasized that contribution to cost of care does not always have to be limited to financial terms alone. So, in conclusion, the artworks that we've presented here today speak volumes about the work that we've done to involve underserved and underrepresented group in setting research priorities. The headline issues which have ensued shows that everyone, especially the patient and the public, are experts in their own lived experiences, and that it is important to uncover and listen to underrepresented groups if we are to be able to offer them support, especially by addressing research questions that actually address their needs and their primary concerns. The promise of contributing to the development of some artwork actually encouraged those people who took part in the group discussions to get involved in the project. So it proved to be a useful vehicle for engaging these underserved populations in terms of research priority setting. Thanks for the opportunity to share this artwork with you. We acknowledge the funding that we received from this project, funded by the National Institute for Health Research, NIHL School of Primary Care Research Evidence Synthesis Working Group. Now, should you have any questions or require further information about this project, please feel free to contact us at the addresses displayed. Thank you.